So contemplating a hair transplant, worried about your hair loss, but still do not know where to go, whom to approach, and how to fix your receding hairline. Well, if you are looking for the best possible hair transplant, that you have stumbled on the correct video for a very detailed information on the perfect eye technique developed here at Medlinks. So let's dive deep into the perfect eye technique. Hello everyone, my name is Dr. Gaurang Krishna. I'm a hair transplant surgeon at Medlinks, New Delhi. So we have been telling all our audience through our social media handles, to all our patients who come visit us, that folks, if you are looking for a hair transplant, then do not think beyond the perfect eye technique. That's the way to go. This is the best, and the way we do it, you get a fantastic result, etc., etc. What exactly is this perfect eye? What are the other techniques of hair transplant? Why we developed, why we chose to continue with the perfect eye technique? So answer to all these questions will be dealt by me in this video. So watch the video till the end, and then we'll have a good discussion in the comment section. See, hair transplant basically is done through the FUT, the conventional way, also known as the follicular unit transplant or the strip technique, wherein a piece of skin, a piece of tissue was cut from the patient's scalp. The hair is chopped individually from that tissue and then planted on the hair patient's bald area. Then came the era of FUE or the follicular unit excision, wherein instead of cutting a big tissue, individual hair roots were taken out, and not exactly hair roots, that's a layman term. Individual grafts or follicular units were taken out from the patient's scalp and then planted on the bald areas. So primarily the techniques of hair transplant differ in the way the hair roots are taken out. What was the need to shift from the FUT to the FUE technique? Primarily three reasons. One, in FUT, just imagine a big piece of tissue being cut from your scalp and then stitched. So of course, pain is a bit more, the recovery is a bit longer, and you will end up with a linear scar. If done properly, the scar is not that visible, but many a times the scar opens up either because of faulty stitching technique or because of the scalp tightness. The scar becomes very, what we call an ugly linear scar. So to bypass these problems, the FUE technique was developed, and in the last 10 years has become very popular. So much so that in a ISHRS survey that was done in a conference about 10 years back, most of the respondents said that they prefer or they do the FUT technique. But in a more recent similar survey done at a similar conference, ISHRS conference, 2-3 years back, most of the respondents said that they prefer or perform the FUE technique. The main reason of this paradigm shift from FUT to FUE was because of more comfortable nature of the procedure, no stitches involved, faster recovery, and the avoidance of that linear ugly scar. So because of these reasons, the FUE technique has become really popular in the last 10 years, and we also at Medlinks used to do that. But then we realized that there's a lot of storage. And we all know theoretically that for every hour of storage, and it has been proven in various studies that for every hour of storage, there is a 2% loss in the hair volume, and also beyond 6 hours, which is considered as a golden time for any human tissue, including hair follicle, that beyond 6 hours, human tissues, human cells, they start to die. And that's why in the FUE technique, the usual results, the usual yield, the outcome that we were getting was between 80 to 85%. So we thought that there has to be a better way of executing a hair transplant, and we developed this instant transfer. We extracted and implanted at the same time. It took us a lot of time because it involves a different patient position, it involves a different doctor position, it involves a different technician position. It also involved totally different hand movements to extract and implant at the same time. But back in 2014, we started performing the perfect eye transplants, and in a couple of years, we perfected this art. And now, most of our transplants are executed through the perfect eye technique. Sometimes we combine FUT and perfect eye. We have totally stopped doing the normal FUE. So we are doing the perfect eye technique. Perfect eye technique is, as I told you, is not a new technique. It's a modified version, is a refined way of executing the FUE technique. The basic steps remain the same. Slits, extraction, implantation, everything is the same. The main difference is that extraction and implantation is done instantly. You don't store the hair out of your body in any kind of liquid, because this has been discussed in multiple times in all our get-togethers, all our conferences, that how to reduce the time a hair spends out of the body, what kind of temperature should a hair follicle be stored in, what kind of liquid should a hair follicle be stored in, because whatever we do, there is some loss. And thus what we do at Medlinks here is we extract and implant at the same time, so that your hair gets its natural environment. What better than your own skin, your own blood, your own tissue to store the grafts in. So we extract and implant your hair follicles in 5 to 10 minutes. Now this has multiple benefits. So why the name Perfect Eye? We thought of a nice name to this new technique, this refined technique that we developed, the modified version of FUE that we developed, and so we called it Permanent and Real-Time Follicular Extraction and Implantation. In short, Perfect Eye. So theoretically, execution wise, the main difference is that there is no storage of hair grafts. Of course, the best of equipment is used, for example, for the hairline area where we are implanting singles, or the temples area where we are implanting thin and single head grafts, we are using micro sapphire blades. For areas where we have to implant multiple head grafts, 2 head, 3 head, 4 head grafts, so there we are using either a cut to size CTS blades or 20 or 19 gauge hypodermic needles, so that we get the best possible density. We control the angles very nicely. We do not cause any kind of scarring on the skin. We do not cause what we call the epidermal changes, meaning there is no cobblestoning, there is no dipping of skin, there is no tinting of skin. Thus the hairline looks very smooth, very natural after our hair transplants. The main question is, what is the benefit for you? Why you should do the Perfect Eye technique over FUE or FUT? See, the main benefits that our patients get are, number one, the surgical time is vastly reduced. So a surgery that we used to do over 2 days, we are doing it in 1 day. So surgery which most of the clinics do in 9 hours, 10 hours, we do it in 5 to 6 hours. The reason being, the 3 hours or 4 hours of extraction and the 3 or 4 hours of implantation are not one after the other. They are together. So an 8-hour job is being compressed into a 4-hour job. So the surgical time is much faster. So the patients do not have the hassle of coming to the clinic on 2 consecutive days, taking the anesthesia on 2 consecutive days. Our patients do not have the risk of overdosing of anesthesia if the surgery goes on for 10 hours. We are totally eliminated the human fatigue factor, because our surgeries have to get over in less than 6 hours. So this causes very less patient fatigue. Patients are very fresh after the transplant also, and it also causes very less fatigue to us, the surgical team. And after most of our hair transplant surgeries, we enjoy a nice cup of coffee together. Another advantage is less post-operative shedding. So you all know that after your hair transplant, you lose almost every single hair that has been implanted over the next 45 days, and you come back to the bald phase that you started with. That causes a lot of anxiety and the recovery period gets delayed. The main reason of this is because of the transplant process, because of the storage. The hair roots go in a phase of shock, and thus from anagen growing phase, they go into the telogen resting phase. But in the Perfect Eye technique, we extract and implant simultaneously. So the hair gets its micro environment, its normal tissue, its normal blood supply very, very quickly. And because of this, many of our patients face very less post-operative shedding. And that's why we have been posting fantastic results at just about 3 to 4 months time. If you ask anyone, if you search on the Google, they would say that it takes 6 to 8 months to get some kind of a decent growth. But many Medlinks patients get very, very fast growth, and that's because of no storage. Lastly, the final result. The final result is usually 10 to 15% better when you compare with the normal FUE. Again, reason being that 10% of loss that happens because of storage, that is totally eliminated in the Perfect Eye technique. So again, when you compare the results, of course, hair results should be compared when you are planning a hair transplant, when you are trying to choose your clinic, you should compare the results. So if you will see, most of our patients, they're getting a much thicker growth, and we are not showing it just by the way of pictures, because pictures can be photoshopped, pictures can be presented by putting black powder. We are showcasing the combing videos of our hair transplant results, so that there is no scope of any kind of tampering with the result. So this was the discussion of the Perfect Eye technique in a nutshell, and that is why these are the reasons: better patient experience, faster surgical time, less post-operative shedding, and much better outcomes, much better results. So these are the reasons why we have shifted from FUE to perfect eye over the last 7 or 8 years, and why 99% of our hair transplants that are being done at Medlinks are done through perfect eye techniques. Sometimes we combine FUT and perfect eye in certain scenarios, and we'll be discussing it separately. But in our opinion, perfect eye technique is the way to go when it comes to hair transplant. Thank you so much.